Let's wait for a few more people to log on. Excuse me. I reckon.
Hi everyone. Kate, do you want to check if you can share your screen?
Oh. Let's see. Let's see if this works. Yay.
Yeah, perfect.
Can everyone see that okay?
Oh, it's disappeared.
Can you see it there?
No.
Let's have a look if you do it a different way.
It did pop up and then it's disappeared.
For some reason, it's not letting me share the entire screen. So let me see if it'll let me do. Give me a sec. Let me see if this will work. For some reason, it's not letting me share, but let me see if it'll let me share. It's not letting me share the entire screen for some reason. I have no idea why.
Want me to try?
Yeah, it's not letting me do it. It's just saying no. Computer says no.
Let me try.
Oh, yeah. Yeah.
Yeah.
See that fine.
I can see on Alyssa's screen it works as well.
Amazing. Okay, so I reckon we get cracking so people are not waiting too long. So hi everyone, thanks for tuning in, and obviously thanks to Acre for making this possible. We obviously wanted to do this because off the back of the live that we did, I think it was last week, my life is crazy. Lots of people have wanted to know the ins and outs and the finer details. Those who didn't obviously see it in publication. I think it went out on the 1st, I believe. So for those of you who did see it, great. But those of you who didn't, obviously, we'll go through as much of it as we can now. And then we've got some designated time at the end to go through some Q&A. So please feel free to pop them in the chat and we will go through them. And also, ACRE have kindly created some little offers for us, which we'll go through at the end. So let's go to the first slide, Justine, if that's okay, hon. Yeah, so for those of you who don't know me, my name is Kate Monteith-Ross and I'm an independent nurse prescriber. I'm the owner of the Clinic by the Ross and also 1/3 of the Nurses Network, which for those of you who don't know is a community to help as medical injectors kind of navigate this crazy world. We wanted to create this case study simply off the back of people asking a lot of questions about what products do, how they can work synergistically. So hopefully this will answer some of those key questions. Yeah. So full disclosures, obviously, before we start, I am a key opinion leader for Dermalux, so LED phototherapy. I work with Neogen and I'm a trainer for Tioxan and Dermafocus, as well as my own academies. So full disclosures all the way. Okay, so this is the study and the logic behind it was simple. We know that treatments work. There is a lot of information out there about polylactic acid and about amino acid replacement therapy. We know they work incredibly well on their own, but the rationale behind this was simply to see what we could do when we combine them. So we know combination treatments are the way to go. That's why obviously the journal dedicated their full issue to talking about combination therapies. And really it's about knowing which therapies work well together, and by trying to do that, you have to understand though how each one of them work and their mechanisms of action. So when we look at polylactic acid, so in the case here, it was the pillar that I used, which a lot of people are more aware of the name Sculptra. Also, obviously, as we know, that's a long-term solution for collagen depletion. We know it requires patience, but also it has incredible results for the right patient. And when we dig deeper into that, what do we need to create collagen? We need certain components, certain raw ingredients. So the logic behind it was simple. Instead of having a reliance on the patient to have a amino acid rich diet and to have certain lifestyle adjustments, what would happen if we were to prime them first? So skin priming, as we know, is a popular thing. So the logic behind it was, if we gave the patient everything that it needs, how could we then get optimum uptake when it comes to collagen and elastin? So this is basically just saying that we know that aging as a whole has been, it's our industry. It dominates the world, and that's why our industry is the fastest growing and continues to grow. While the rest are in demise, we're still growing. And the reason for that is simply because, looking good and feeling good is key, it's paramount. But aging as a whole is something that we're continuously educating ourselves on as medical practitioners. We're trying to look at how to address that. We know we age at every level. We know we can address skin laxity, muscle contraction with toxins. We know we can address fat depletion and fat atrophy with dermal fillers. But our patients are now becoming more aware of that scaffolding, the need for those structures to be in place. Amino acid replacement therapy and polylactic acid, both we know work. However, the literature that's out there at the minute is really about these independently and in isolation, rather than talking about them in terms of a combination. So what we wanted to do here was look at whether it made a difference by priming them first before we worked on that collagen restoration. So why polylactic acid? So I know polylactic acid, Sculptra, PLLA, Estella, whichever brand you're looking at, is something a lot of people are nervous about. And I appreciate that. With every single treatment that we do, we need to fully understand it. And I understand that people get nervous with PLLA because essentially the protocols with it are not as straightforward. If we cause an occlusion with HA, it's reversible. With polylactic acid, it isn't. So I understand the nerves behind working with it. I get it. But if you understand the product, understand how to treat your patients effectively, and if you put measures in place, it can be an incredibly safe treatment, and also one that has amazing results. The reason I like PLLA, it's not a treatment I do as often as everything else, but the reason I like it is we're moving into a realm of regenerative medicine. We are here, and we're likely to remain here. And the whole regenerative medicine topic or title, if you will, really just embodies this need for the industry to want more natural, holistic results. Something that isn't going to change the anatomy, isn't going to compromise anatomy or impede functionality. We're looking for treatments that will enhance, that will provide simply an anti-aging solution rather than the pillow face that 2 years ago we become so used to seeing. Now, the way, obviously, the way that we age, we are losing that key collagen and elastin, and depending on how much we've banked, in our early years, will dictate how steep that decline is. But it is key. And we talk about collagen as a whole is a subject that we throw around, or a name that we throw around. And I still find a lot of practitioners still don't quite understand how collagen works, how we get it, how we bank it, how we lose it, and how we stimulate it. And the key and why collagen enhancements are so important is because we don't recreate it. When we stop, we stop. So we have to find solutions for our patients to address that. So PLLA is a biostimulator. So it triggers new collagen production through neocollagenesis. We know that. So it promotes the skin rejuvenation, and we do it from within. Essentially, the results that you get, the first few times I did it, I was obviously very nervous doing the treatment, and the results were mind blowing for me. And I think this is the key. Once you've seen it, once you've seen a patient go through that journey, it's very difficult to recreate that. Nigh on, in my opinion, impossible, because it does completely change the architecture of their skin. You know, I've seen a patient, one of my patients who I treated with polylactic acid has had rounds of polynucleotides and various other treatments in the past. Her skin's always been quite thin. We treated her with a course of polylactic acid, and I haven't seen her for 4 months. And she came in last week for a polynucleotide treatment, and it was incredibly difficult, not in a bad way, but the thickness of her skin was significantly different. I noticed, because I've treated this patient time and time again, navigating that cannula through that plane too was a little bit more tricky than it was before, because that dermis is thick, the skin is tight, the cavity, you know, there's just not that much room for navigation. And it just really shows you how powerful this treatment can be. So I've put on here a little bit of an explanation in paragraph 3 in terms of how it does what it's meant to do. And there's lots of case studies and clinical studies out there that will say what you should use, how many vials you should use, and how you should reconstitute it. But for the purposes of this study, we looked at using a single vial. I didn't want to complicate it. I thought, let's just stick with one vial and let's see what we can do. Now, we know that we have to reconstitute it. That can be, you know, we take one vial, we reconstitute with roughly 10 mils in the end. That's what we've got to play with. So what that means is we can cover a vast amount of areas on the face. Now, for this study, both of the case studies I worked on, it was very much in that buccal fat region. So both of them had lost that gonial angle. The face was almost collapsing forward. We know we've got patients like this. We see it all the time. So I didn't actually do any deep injections. This was all done by cannula, all done in play, you know, quite deep into the tissue and almost in a fanning technique. And that was the way we did it. So we know that it builds slowly over time. So when you use PLLA, you can't really judge the results until you are far down the line. However, you will see a change kind of as you approach that 8-week, you know, post-treatment. The limitation for this study was I'm far too impatient. So I wanted to gauge the results. So we reviewed them 8 weeks post-treatment. And since then, I have actually seen these 2 case studies since, and the results have continued to improve. The reason that I chose this product was simply because, for me, the results have been fantastic. We know the aesthetic results that we've been getting is an increased skin volume. So you're getting those subtle volume changes, especially around here. You can see that change in firmness. The skin feels almost like cling film back onto its shell, and the elasticity within the skin. That's really important, because we talk a lot about collagen and restructuring those fibers to get that firmness. But if we don't consider the elastin, it is only going to face degradation the minute, especially in those hypermobile areas, the minute we start animating and moving on with our life. So the fact that we can address collagen and elastin at the same time means that not only will we get a change, but we'll get a change that lasts as well. We can go on to the other side, Justine. So the other question was, why did we look at using amino acid replacement therapy? And I alluded to this at the beginning. Now, anyone who knows Jalupro, the range is extensive. And I know not a lot of people have had experience of all the products. Me personally, I am a fan of the Jalupro Super Hydro, the classic Young Eyes and HMW. But I think the reason I chose to work with the Super Hydro is because both of these particular case studies, both the patients, there was an implication on their retaining ligaments. So as we know, we age at every level: bone, deep fat, SMAS, superficial fat, and skin. The skin and that collagen elastin is going to be dealt with by the PLLA. But what I wanted to do is, using the Super Hydro, my logic was, we're going to not only provide that put back into our patients those key raw ingredients that we need, but essentially we are also going to be addressing those key retaining ligaments. And you think about what those retaining ligaments do. They are essentially the glue that holds the face together. And from my understanding, there is no other treatment on the planet that alludes to treating those retaining ligaments. So to me, it seemed a logical conclusion. So we know amino acid replacement therapy, or Jalupro, I'm going to say that instead of saying the whole shebang as we go on. We know that it is the building blocks, the key building blocks for collagen production and cellular repair. So we know there isn't a reliance on our patients to have them, because we're giving them to the patient. Now, they combine all this, so you've got the amino acid with those bioactive ingredients, and what that will do is work on the firmness, hydration, elasticity for your patient. So even if you were just treating your patients with this treatment alone, it's not just about getting those raw materials, but standing alone, this treatment will lift, tighten, and restructure the skin as well, and from a deeper perspective than we've seen before. Oh, sorry, where have we gone? There we go. So can we go back? Sorry, Justine. There we go. So I've put on here as well, for those of you who aren't aware what the Super Hydro is, we're getting it within our skin. We need certain amino acids, and we know amino acids are a bigger molecule, and then we have peptides as well. And by using a combination of both, you're going to get that superficial as well as deep revitalization. Now, there is it is a very, very thick, there's a high viscosity to this product. So what you're going to get that strategic lift. Now, the minute you treat your patients, because we are treating on the ligament themselves, which I know for a lot of people is unnerving, they immediately feel a lift. Now, obviously, this is the case because we have physically put something onto those ligaments, so they're getting a change. But we all know patients like to feel a change and see a change. And when you treat your patients with this Jalupro Super Hydro, immediately they can see, and it gives them an insight into the results that they're going to get. So with other regenerative treatments, there is a heavy reliance on your patients being patient. With this, they do get to see those results a lot quicker, which can really help. And working on that collagen production and deep connected tissues of the face, you're going to get that lift immediately. So on the next slide, we've talked about why do we use primers? Now, we know primers are key. As a clinic, we're a plastic surgery clinic as well. So we see a lot of surgical patients. And as a plastic surgery nurse by background, I have a real bee in my bonnet in terms of preparation for surgery. I think it's an important stage that we don't emphasize enough. So when I'm prepping a patient for surgery, I'm talking to them about their nutrient profiles, their weight, their lifestyle choices, whether they're smoking, whether they're hydrated enough, whether they're active enough. And one of the things that I do is, this is all about wellness and recovery. But when, at the end of the day, a lot of people are having surgery for a purely aesthetic outcome. So if you've got a patient who's going to have their skin compromised, their skin barrier compromised, and a reliance on that skin rehealing, and hopefully healing without any complications, any hypertrophic scarring and so on, keloids, then if you can do something to that tissue to prepare it, to make it healthy, it is an organ like any other, and provide it with the key ingredients it needs to recover, you're always going to get a better result. So we approach any surgical patient and we treat them initially with our tools in our regenerative belt. But there is no difference with PLLA. We know that we want the PLLA to do its job. We know nothing quite works as well as it does for long-term collagen restoration. But it is dependent on those key things. So if we can provide our patients, if we can prime our patients we know we're going to get an improved penetration of that PLLA, which will enhance the delivery and will improve the overall result. We have proven it. And also one of the things is we know the Jalupro Super Hydro has an anti-inflammatory property. So in terms of recovery of each treatment, it expedites that. So how did we set it up? Well, that was similar. We looked at 2 individuals with similar signs of aging, mild to moderate of collagen degradation, and we analysed them. Initially, we used a 3D visage scanner to look at their makeup from the inside out. We also use a Canon to take pictures, same lighting, same space, the usual shebang, but we got them to fill out an emotional grading. Now, this is something we do in hospitals all the time. You know, we get people to fill out various surveys to assess how they feel about something, because that is a massively significant impact. You know, sometimes we can make very small changes, but these can be life-changing for that patient, and understanding that is key to understanding the success of a treatment. So when we put this study together, we wanted it to have an element of that. So we used the same kind of scoring that we would use for surgical blepharoplasties, but we focused it and adapted it for the face. Now, both of them suffered with severe laxity across the buccal fat region. We knew there were bone density changes across the mandibles, zygomatic, maxilla, all around those key areas. And there was severe atrophy in those deep fat pads and superficial, which resulted in a loss of elastin and collagen. Literally running your finger across their skin, it just rippled up and didn't snap back. So both of them were severely depleted. Now, both patients, excuse me, were keen to make sure that they didn't compromise on a natural result. So considering PLLA for both of them was key, because what they didn't, you know, there are limitations to dermal filler. We fill. And if we are just literally filling and filling and filling those deep or superficial fat pads, if that skin is not supporting that, we're never going to get an aesthetic result that looks natural. It's impossible. So what we wanted to do, it was a no-brainer that we were going to use PLLA, but to get that optimum result, we needed to look at combining it with the Jalupro Super Hydro to make sure that we get the results that we want. Obviously, both of them went through the same process. None of them are allowed to have any skin treatments while they were on the study, which lasted months. They weren't allowed to go on holiday, not allowed, passports removed, and they were asked to just stay out of the sun as much as possible. We checked up on them and we treated them in exactly the same way in terms of the treatment, you know, the treatment plans. So this is patient A. So a little bit, I know this is a little bit wordy, but this was patient A. So she was the older of the 2, but strangely enough, not the most degraded of the 2 in terms of that collagen depletion. The logic with her, she'd had dermal filler in the past, she'd had polynucleotide, she'd had skin boosters, she'd had light therapy, she had, and obviously had regular toxin. But what we couldn't do is we couldn't get that snap back to her skin. No matter what we did, she was just always unhappy with this region. It caused her and me, I will say, a lot of earache, because it just, you know, no matter how much we did on a deep level, we just couldn't get that structure. So we used Jalupro Super Hydro 29 gauge needle, and what we did was we targeted the ligaments in her face. We did a total of 2 treatments. The rationale for this patient was we wanted to get that lift and rehydration, and we did it completely by cannula. Completely by needle. So there is no cannula with the Jalupro Super Hydro. So it was key ligaments, using the needle deep onto those ligaments. We followed them up 6 weeks in between, and a total of 8 mil was delivered. 16 mil, was delivered over the 2 sessions. Okay. Now, at the time, we also then followed this up with 8 mil of PLLA. Now we can reconstitute it with the 10 mil, but we just used 8 mil for this patient. We used 4 mil each side, and the reason being is I felt that was enough to treat this buccal region. Now, when we when we look at the scores in terms of the 3D visage, there was a significant improvement in terms of them. So and the reason we wanted to do the 3D visage is because a lot of the time, aesthetically, we're looking for a structural change, but it was interesting to see the impact with the Jalupro Super Hydro on things like sensitivity, inflammation, and so on. So as you can see here, the sensitivity decreased nearly to half. The wrinkles and fine lines decreased from 98 to 74. The pore reduction was there. The deep pigmentation reduced, although not significantly, it still did. And the acne decreased. Now, although this patient didn't have acne, she did have disruptive, balance. There was a sebum balance there that we needed to get under wraps. And we've seen that should say decrease, by the way, the surface pigmentation. And that went from 34.9 to 29.5. So there was a decrease and an improvement across the board. Now, in the emotional grading, this was where it really kind of ran true. The patient scores, we looked at the scores of their eyes and the cheek area, and we looked at 2 prior treatments. So what we said, if you look here, so we started off, they scored to 5 following the Jalupro Super Hydro, to 10 after the entire course of treatment. And her lower face scores went from 2 to 5 to 9. So as you can see, the Jalupro Super Hydro definitely made the biggest impact on this patient. Now, after completion, what was clear is that even though we didn't treat her neck, the lower third and middle third of her face had lifted that significantly, that it had an impact in her neck. She didn't have any fillers. Her jawline had improved. Her rounder mouth had improved. Now, what was crazy is immediately after she had the Jalupro Super Hydro, she was incredibly happy. And at one point, I remember reflecting on the fact that we could have probably just ended the treatment there, because she had a significant change. She had that lift. But remember, the logic for combining it with the PLLA was to get that long-term improvement with the collagen. And that's the key. Now, we know that PLLA will continue to build for up to 25 months after. So that itself was the logic behind it. But she's seen an immediate change with that Jalupro Super Hydro. So it removed any anxiety around any disappointment relating to the PLLA, because sometimes patients, because they're looking at it every single day, and it can take up to 25 months for it to continue to work. A lot of patients don't like hanging on that much, but obviously the PLLA was supported by the Jalupro, so it took that out of the equation. And then patient, as you can see here, and what I really do need to stress though, it continued to get better, because these pictures were actually only, I think, 8 weeks after she'd finished the protocol. I have seen this patient since, and it has improved monumentally. So that obviously was something we discussed as a limitation, but the improvement was monumental. So let's look at our second patient now. So this is patient B. The difference between patient B and patient A is patient B had more treatments of the Jalupro Super Hydro. And I think you can see here that had a positive impact. When we treated both, we have treated both with the PLLA, and both the skin quality and the collagen was absolutely restored. But what dominated this study was the fact that the patient that had more treatments of the Jalupro Super Hydro had such a difference in terms of that lift. And that has continued to get better, obviously, through the PLLA. Now, her scores were improved again across the board, and her emotional grading was significant. So both of them, to be fair, there wasn't much change in how well they perceived the treatment plan. But I think for our point of view, patient B got a far more significant change. The structure to her face, the tightening of her skin, the elastin of her skin, the improvement of skin quality. But the main aspect for her is she said that the minute she finished with the 3 treatments of the Super Hydro, when we were discussing, She said even talking and smiling felt different. She said she felt like her face had thickened and become much heavier. And she said it's a very weird thing to say. And I said, is that a bad thing? She said, no. She said, it's really hard for me to explain. She said, but I feel like my face has kind of come back to me again. And she said, when I smile now, I kind of feel my cheeks lifting. I can feel everything tightening. Whereas at one point, it just felt like it hung off my face. So this was one that I was so happy with. And we've continued now to use this as the bog standard protocol within our practice. We do a minimum of 3 Jalupro Super Hydros now, and actually sometimes 4, depending on how much lift they need, before we do any polylactic acid treatment, because we proved that the results are just massively enhanced. As you can see, it's even crazy to see, like, oh, sorry. If you go back, just one more for me, just see. Yeah. You can see on here how it's improved the marionette, the nasolabial fold, her neck, her jawline, her gonial angle is a lot more structured. Even if you think about where those retaining ligaments are, when you look around the temple region, around the bicularis oculi region, you can see the restructuring and the tightening. It really was incredible to see the change, and it's continued to get better, which is even more reassuring for us. Okay, so what does this show us? So this shows us that we know that priming is a thing. We know that it works across the board, depending on whatever treatments people are having. But if people are going to have a treatment that relies, or that the goal is collagen enhancement, then really we're doing our patients a disservice if we do not prime them first. We have to give our patients those ingredients, or they're just not going to get the results that they want to get, or it may take more treatments. The way I see it is, especially being a nurse, I'm a risk averse person, of course, if I could get those results that I can with polylactic acid, with a dissolvable hyaluronic acid based derma filler, I would, but we can't. So if I can do something beforehand that will limit not only how much volume of the polylactic acid I need to use, but also how many treatments of it we need to do, then I'm going to do that. And using the Jalupro Super Hydro, we've now come to our conclusion with what is the prime protocol, and that is 3 to 4 treatments of the hydro before a double treatment of the PLLA. We haven't had to exceed that PLLA so far because the results have just been incredible. We know that it's compelling. We are working on a far bigger study. We're going to look at comparing certain different protocols to see which one really works. But for us, right now, we've definitely concluded that this is the protocol for us. We know that it would be great to look at a far more extensive range of patients as well, just to see how we could play around with that. Because remember, when we look at the retaining ligaments, we are talking of full restructuring. And although these patients were a lot older with mild to moderate signs, there is still a lot of evidence there to say that we could treat younger patients as well. Okay, so this is an incredible event that is being put on by Acre and Jalupro, and this is going to be in London. I attended this last year, and it was an incredible learning experience. And the team have worked so hard. They've reflected on what worked well last year and looked at taking that and making it even better. So in the morning, excuse me, we're going to be focusing on a lot of the key topics that people want to know at the moment, which is all about business and really looking at how you can take those patients and work with them over long periods. But then in the afternoon, we're going to be talking about some really key uses of Jalupro, such as combining it in combination treatments, even combining Jalupro with botulinum toxin, which is very, very current at the moment. So we're going to be covering all of that. The early bird tickets are available at the minute, which are just £59. Normal standard tickets are £79. but it's a great experience. It's 10 to 4, it's in a central location, and following anyone who's come to the webinar today, you can also get an additional 20% off. I would really, really advise you to go, because I just feel like we still are in a realm where people are confused about how Jalupro can fit or how it can enhance and also stand alone in their practice. So we're going to be having a lot of fun with Jalupro that day. You'll be hearing from me and a lot of my incredible colleagues as we talk about how much you can embed Jalupro within the fibre of your treatment to get exceptional results for your patients. And we also have another event here, which is on the 21st of August. This is slightly different. Yes, we're still going to be talking about a little bit about PLLA, but this is more about regenerative medicine in terms of polynucleotides. So we're going to be looking at polynucleotides as well as Jalupro, touching on a little bit of PLLA, a few little business talks as well. A lot of fun, and obviously pizza and prosecco included. So that's amazing, and that's been brought to you again with Dermafocus, ACAR, PLLA, and Jalupro, and the Nurses Network. We're all working together to create a really affordable little experience, and that's going to be in London. So if you are interested, again, you can use that code Kate and get 20% off what already is an incredible ticket amount, and you'll get obviously goodie bags, discounts, and more. So please do come along to either of those, if not both of those events, because they're going to be a lot of fun. Okay, so these are just my my business clinic by the Ross, and also the Nurses Network. So following this, if anyone has any questions, you want to reach out to me, that's absolutely fine. You know, please do. If you do come to any of those events, please feel free to come and say hi if you want to talk about something. But apart from that, if you have any questions now about anything that we went through, about any of the events, please hit me with it. I'm going to have a look on the chat just to see if anyone had anything. Let me see if there's anything there. No. So if anyone does have any questions, please feel free to hit me with it now. Anyone brave? Okay, what's we got? Somebody is typing. I just want to make sure you guys get the most out of it, because I realize there's a lot of information to run through. So the brand that I use is The Pillar, and it's available with ACAR. I haven't used Espella. I have used Sculpture in the past. Excuse me. I used PLLA, The Pillar, sorry, from ACAR off recommendation from a colleague of mine who'd had incredible results. So I've used Sculpture in the past as well, but I've been having incredible results. And I know when we use PLLA, you know, a lot of people worry about how that recon process and, you know, hyperdiluting it and things like that. So I've never had an issue with it, and it's always been an easy product to use. What techniques to administer? So obviously when we use Super Hydro, we use a needle and we use it deep onto those retaining ligaments. So when we do the training, and in my case study, and obviously I assume you'll get a copy of this if you request it, I talk about the retaining ligaments, how we find them. So you palpate them, you know, just look at those key ones. But what I would say is, with a product like Super Hydro or polylactic acid, it's really pertinent that you do have that high quality training. So please do reach out to ACAR about arranging that, because I think due to the viscosity of Jalupro Super Hydro and the way that it's administered, a lot of people can get quite nervous. And I think the first time you do it, you do want to be, you want to have that supervision, someone at the side of you to help you go through it, to mentor you, to make sure that you're identifying those key points, and that you know how to inject them. The first couple of times I treated a patient when I was trained, it is a little bit unnerving. I think it's just simply because it's a new thing. It's a new way to do things. We've not been injecting on retaining ligaments before, so there is an element of the unknown. But just to speak to ACAR, they arrange in training all the time, and it's incredible training with some amazing doctors who you will probably meet at the Congress as well. And you can access training really affordably from them. But I would really recommend getting training in Super Hydro, just because it is, you know, it is an incredible treatment. You want to make sure you're getting the most from it. When I use PLLA, obviously I use a cannula. Yes, obviously we've got training, which, like they said, there is on the 21st of August. That will be at that event, the Prosecco one with pizza. So yeah, feel free to jump on that. And we're going to be talking about polynucleotides, PLLA, Jalupro. We're going to catch on and cover various things. So please do come. And that's obviously in London as well. I'm like at bated breath watching the typing. That's Sylvie, that's in London. We will be, you know, if you contact ACAR, they always have training available. So it's at Dr. Prima's clinic, which is in Mayfair in London. It's a beautiful location for the training and the Congress. The link is up on this Q&A section. There is a link for the tickets for the Congress, and the address is on there. But again, it's in London. But if you can't make either of those dates, the Congress in September or the August event, then please just reach out to Baker, and I'm sure they'll provide you with a variety of dates that they can do. But we remember the Congress is in September and the training is in August. I look forward to seeing you, Anna, and hopefully we'll get to discuss it in a little bit more detail then as well. Absolutely, Lisa. So I use the standard technique, targeting the retaining ligaments, exactly the same as me, just the standard protocol. And yes, like I say, there's going to be lots of training available with ACRE. So just get in touch with them directly, and I'm sure they'll provide you with as many dates as possible. But again, remember, the Congress is in September on the 20th. So that's going to be an incredible opportunity to really take a deep dive into it then. I look forward to it too. Right, guys, so if there's no other questions, you've got my contact details, you've got ACRES. I look forward to seeing you hopefully in August, but if not, at the Congress in September. Please do get in touch, get some information. You know, these treatments work beautifully and can do so much for your patients. So please, you know, please get on board. Don't be frightened of them. There's no need.
Thank you, Kate, and
Thanks,
thanks to
guys.
everyone who's attended.
Thanks. We'll see you soon. Bye.
Bye.